The World Health Organization calls climate change the greatest threat to human health in the 21st century. This is not hyperbole. It affects us all, directly and indirectly. Rising sea levels displace millions. Extreme weather events cause injuries and death. However, some of the most alarming effects are less visible, slowly impacting our well-being in ways we are just beginning to understand. This is the hidden crisis of climate change. The statistics are sobering. The Lancet, a leading medical journal, estimates that climate change is already responsible for millions of premature deaths each year. These numbers are expected to rise dramatically in the coming decades if we fail to act. This is not just an environmental issue. It is a public health emergency. Our health and the health of future generations depend on addressing this crisis now. Rising temperatures exacerbate air pollution, leading to respiratory problems. Heat waves trap pollutants like ozone and particulate matter, triggering asthma attacks and other respiratory illnesses. Children and the elderly are particularly vulnerable. Studies have shown a direct link between rising temperatures and hospital admissions for respiratory problems. For example, a study in Los Angeles found that for every 10-degree increase in temperature, there was a 4% increase in hospital admissions for respiratory illnesses. These impacts are not just limited to major cities. Rural areas are also experiencing increased respiratory problems due to wildfire smoke, another consequence of climate change. Climate change is expanding the range of disease-carrying insects. Warmer temperatures and changes in rainfall patterns create ideal breeding grounds for mosquitoes, ticks, and other vectors. This leads to the spread of diseases like malaria, dengue fever, Lyme disease, and Zika virus. These diseases, once confined to tropical regions, are now appearing in new areas, affecting populations with no prior immunity. The World Health Organization warns that climate change could lead to millions of new cases of malaria each year, overwhelming healthcare systems. The consequences of inaction are dire. Section 4. The toll on mental health. The mental health impacts of climate change are often overlooked, but no less significant. Extreme weather events, displacement, and the loss of livelihoods take a toll on mental well-being. Anxiety, depression, and post-traumatic stress disorder are on the rise in communities on the front lines of climate change. Farmers facing drought and coastal communities losing their homes to rising sea levels are particularly vulnerable. The American Psychological Association recognizes climate change as a significant threat to mental health, calling for increased research and resources to address this growing crisis. Section 5. A call to action. The evidence is clear. Climate change is a public health emergency. We cannot afford to wait for more dire consequences. The time to act is now. We must transition away from fossil fuels, invest in renewable energy, and promote sustainable practices. Our health and the health of future generations depend on it. This is not just an environmental issue, it is a matter of life and death. We must demand action from our leaders and make changes in our own lives. The future of our health and the health of our planet hangs in the balance. Subscribe to our YouTube channel for more updates and ways you can make a difference.